My name is Maggie Widom, and I was 33 when I had a stroke, a hemorrhagic stroke. The hemorrhage started on a Sunday morning, and I had a headache, and I didn't feel good, and I thought maybe I had the flu. And I thought, if I just get some rest, if I just eat well for a couple of days, I'm going to be fine. Turns out I did not have the flu, I was having a stroke.
Maggie Widom's stroke occurred in December 2014 when she was studying to get her master's in theater. Since then, she's worked tirelessly on physical, occupational, and speech therapy to recover. Maggie uses a cane and has vision issues. She says she's not the same person she was before her stroke.
My stroke in particular was not preventable, but I think the mentality is out there for people. Don't show any weakness, don't go to the doctor, just power through something. And stroke is not something you can power through.
There are two different types of strokes. The most common is ischemic stroke, which occurs when a blocked artery limits blood and oxygen to the brain. Then there's what Maggie had, a hemorrhagic stroke caused by bleeding into the brain tissue. Dr. Ira Chang is a neurologist. She says while the majority of stroke patients are still older than 50, the lasting effects for stroke are the same regardless of age.
The impact of having a stroke at a younger age is much greater because those are your more productive years. So the economic impact, the social impact, and psychological impact is much greater.
You think you're going to be setting up the things in your life, your marriage and your career and your children if you're going to have them and all these things, and then a stroke can just change all of that.
Compared to 20 years ago, the incidence of stroke rates are rising in young adults. A recent study in JAMA Neurology found that hospitalization rates for ischemic strokes in both men and women under the age of 45 is increasing.
I think we're seeing an increase in stroke because we are seeing more risk factors that can lead to stroke in younger people.
Chang tells Newsy she's seeing young patients who smoke or vape, drink a lot of alcohol, have high blood pressure, high blood lipid counts, obesity problems, or are taking birth control. These can contribute to the risk for both ischemic and hemorrhagic stroke, and Chang says some patients show a combination of 3 or more of these risk factors. Have you seen more patients coming into the hospital with stroke than maybe like 5 years ago, 10 years ago?
We have definitely seen an increase in patients coming in. They're encouraged to come in, much like with heart disease and heart attacks years ago, because now we have a acute stroke treatment. We can give them a clot dissolving medication, or if they have a hemorrhagic stroke, we can give them medication to bring down their blood pressure. But these medications can only be given within 3, maybe 4.5 hours, or procedures that can be done need to be done before there's tissue damage.
Chang says there's been some progress in the field. For example, doctors can use telemedicine to quickly diagnose patients. With a conferencing app on her phone, she can diagnose patients in minutes at hospitals across the country. Chang also says awareness campaigns have helped patients recognize the signs of stroke, face drooping, arm weakness, or speech difficulty.
I was lying in my hospital bed in the ICU, trying desperately to move my hand, to lift my arm, and I thought, for a while about how do I relate that to people visually. So I took this Barbie and I took a nail gun and nailed her to this chunk of wood.
As for Maggie Widom, she's still doing her physical therapy exercises. This year, for the first time since her stroke, she's performed in a play. She's working on an art show that depicts her feelings and experience surviving a stroke, and is making a documentary about it too.
I thought everything was over. Every good part of my life was done for forever. And that's not true. I'm going to be out there as an advocate for stroke survivors, an advocate for people with disabilities and chronic illnesses. I want to be that person that is out there being seen so that other people, if they have a stroke, they can see me out there and think, it's going to be okay.